Welcome back. Governor Gavin Newsom presented his updated state budget today. It's his final spending plan as governor.
It's a positive fiscal outlook for the state, according to the governor. ABC 10 State Matters political reporter Jenny Hutt joins us now to explain. Jenny.
Well, the big difference between Newsom's initial budget proposal from January and his updated proposal today is that new numbers show there's no budget deficit for the next 2 years.
I'm not just trying to get out of Dodge and enjoy 6 months of the next governor saying, well, I left you a balanced budget. This is a balanced budget structurally for the next 18 months after I'm gone.
A $350 billion budget proposed for California's upcoming fiscal year. But some positive news, Newsom says, amid years of budget deficits and criticism over state spending. No deficit for the next 2 years.
We got a detailed plan, and we're cutting deficits.
In his initial January proposal, the Newsom administration had projected a budget shortfall of about $2.9 billion next year and $22 billion the year after. So how is California in a budget surplus of about $4.5 billion next year and $2.1 billion the year after now? It's a mix of factors: higher than expected state income tax revenue, largely due to the AI boom and resulting success in the stock market, as well as additional revenue via additional taxes on corporations.
Some limited tax decreases for small businesses, but then tax increases on corporations, particularly tech companies.
But also more cuts to healthcare programs, especially on coverage for undocumented immigrants.
We're also looking to reduce costs, and this is where we get into, the more challenging issues.
Additional proposals, which Newsom says were forced upon the state due to new eligibility requirements from the federal government, including raising Medi-Cal premiums for undocumented immigrants from the scheduled rise from $0 to $30 to $50 instead.
That's called reality. It's called math. That's a difficult thing, and we try to do it in a thoughtful way. It was originally $100. They went down to $30, I think $50 under the circumstances, but good people going to disagree.
And transitioning certain undocumented immigrants to fee-for-service health care, which would save the state $1.5 billion in the coming years, but could make accessing certain care more difficult for people.
Well, fee-for-service is a direct result of the federal government.
Meantime, Republicans are once again criticizing the governor's fiscal outlook as concerning and irresponsible.
He really isn't doing anything about the structural debt, bringing spending down to a level below revenues.
Newsom also said his administration has been able to cut projected deficits in future years by half. So, for example, fiscal year 2028 to 2029, the deficit is expected to be about $10 billion, the same in fiscal years 2029 to 2030. Chris, Laura.